welcome back to the YouTube channel Mental Matters More. I am Amanda G, Psych NP, and this is the channel where we talk about all things related to mental health. Well, today I wanted to talk about something that is so interesting to me, personality disorders. In last video, I talked about how a lot of people self-diagnose on TikTok and social media platforms. And I was thinking about the topic of personality disorders. And I certainly have self-diagnosed myself with my own personality disorder, which I'm not going to go into detail about, but if you know me, you can guess. I wanted to talk about the different types of personality disorders, the different ways to identify which category you may fall into. And if we do have a personality disorder, what exactly does that mean? Well, you may have heard some people described as OCD, they're so OCD, or they're so paranoid, or I swear they're narcissistic. So those are actually types of personality disorders. And in mental health, there are 3 personality disorders. We call them clusters A, B, and C. And personality disorders fall within there. And so in mental health, we're supposed to use this great big Bible, which is our DSM-5, tells us all the different criteria for mental health issues, including personality disorders that you sometimes use, you can see, and then sometimes I don't, which is controversial, but we won't get into that today. Well, the first personality disorder cluster is called the A, and this is labeled as the odd or eccentric. And there are 3 types that fall in here. We've got paranoid personality disorder, schizoid, and schizotypal. And these are individuals that, like it said, are paranoid and they may withdraw from society. These individuals have difficulty maintaining and forming relationships with other people, and not be interested even in having relationships with others and be interested in social contact. The second group, the cluster Bs, are the behaviors or emotional personality disorders. This is where we see borderline personality disorder, narcissistic, histrionic, and antisocial. So these are the individuals that are very emotional. We have a very erratic mood. They're up and down. A lot of times they get attention because of their mood. So you may be able to notice that or point that out easier than some of the other types. Individuals that fall into this category also have a very difficult time with relationships, with making friends, keeping friends. Their emotions are so extreme that it really gets in the way of the relationships. The one that I want to point out here is the antisocial personality disorder. And this is really the most difficult. 35% of individuals who are incarcerated actually meet criteria for having antisocial personality disorder. So it's one that it makes it very difficult to live in a society. So the last group is called cluster C, and this is anxious or fearful personality. And we've got avoidant personality disorder, dependent, and OCD, obsessive compulsive disorder. And these individuals tend to be a little bit more neurotic. We've got rituals, we've got high anxiety that are fueling the behaviors that we're doing in order to maintain our feelings and our emotions. And again, making relationships, keeping relationships, a lot of times these individuals are withdrawn because they have so many rituals and fears that they have to keep up with when managing their anxiety. So it makes it really difficult to have relationships, work, function, go to school, basically live a happy, normal life. So the truth is we all probably fall in the spectrum somewhere of one of these personality disorders. The big question is, does it affect us or impact us negatively in life in general? Are we having a difficult time with relationships? Are we having trouble at work? Are we not able to go to school? And if this is the case, then we can look at ways to treat it. So what are the treatments if you feel you may have a personality disorder? Has a good mental health professional to develop a plan that's going to work for you is going to be beneficial. There are treatments, there are therapies, there are FDA-approved medications that can help with some of the symptoms and can help you to make connections as to why you're doing things and modify your behavior. As we've talked in other videos, we know that the brain can change. It's called neuroplasticity. And so that's the good news, that there are things that you can do to really live a happy, functioning life. One of the interesting things, though, about having a personality disorder is that most individuals don't realize they have one. And that's because that's your personality. Most personalities are developed and formed about adolescence and teen years. And if that's how you act and that's how you behave and you've figured out ways to deal with that, then it's really hard for somebody to say, hey, I think this might be a personality disorder. A lot of times these individuals aren't willing to recognize it and therefore aren't willing to get help. So how do people develop personality personality disorders? Well, it's simple: genetics and environment. If your parents have a personality disorder, you're more likely to have one. And then if your environment, possibly you had an unstable or emotional childhood, these are factors that can play into if an individual will develop a personality disorder when they're older. As I mentioned, therapy, medication, treatments have been proven effective to help individuals with personality disorders. The one exception to this is antisocial personality disorder. And while there are medications that can treat some of the symptoms of the disorder, there have been no actual therapies or interventions that have proven effective for these individuals. And unfortunately, this is why we see a high number of individuals incarcerated with antisocial personality disorder. And there are some cool tests that you can take that I have found that can indicate what kind of personality you have. One of the most famous is called the Myers-Briggs personality test. And it's the series of about 100 questions, and you'll be put into a category of 1, 2, 3, or 4. And that's an interesting test to take if you want to know what kind of personality you have. I'll put the link for that in the description below. There are some other tests that I have found. One's called 16 personalities. It has about 25 questions that will put you into a category. So these are interesting ways of identify what kind of personality you have. As I mentioned in one of the shorts I uploaded on YouTube, that weaknesses can be strengths, can be weaknesses. And this is the example where I feel this is also true in personality disorders. A lot of times things that make it difficult for us to engage with individuals and to do certain activities in life due to a personality disorder are actually things that can help us be very successful in other areas and help us succeed and, live this great happy life and be able to actually help others. So it's really about knowing what are your strengths and weaknesses and how they impact your life and others, and taking that energy, harnessing it, and putting it in the right direction where you're going to help benefit yourself and others and family members and live a happy, productive life with your unique personality. Again, thank you so much for watching. This is the YouTube channel Mental Matters More. I am Amanda G, Psych NP. This is the channel where we talk about all things related to mental health. If you found this interesting, go ahead and subscribe. Let me know in the comments if you've subscribed. I subscribed. I want to make videos about things you guys want to talk about. So let me know what interests you and I can make a video for you. I look forward to talking to you guys soon.